Good morning, everyone.
Good morning.
Thank you so much for being here. I have a lot of bass in my voice. And a special thanks to Ed Jimenez and the entire team here for welcoming us and opening the doors. University Hospital has been a great partner for us, and it's great to be back here. So in New Jersey, I have spent almost 6 years listening to mothers who have lost their babies or very nearly their own lives, fathers who have lost their life partners, and countless women of color who have told tragically similar stories, stories of not being listened to or receiving the care they needed and deserved at a time when they could not have been more vulnerable. And as we have worked to raise awareness of this crisis, as well as solve it, I have seen New Jerseyans from every corner of our state respond. Some with shock and outrage, others with sadness, but all with a determination to raise up these collective voices and demand an answer to their plea for racial justice, for reproductive justice. Through our Nurture NJ initiative, we seek to answer that call. And today we are announcing legislation that will move us one step closer. Since early 2018, we have taken a comprehensive and meticulous approach to understanding the scope of New Jersey's maternal health. I am incredibly proud of the steps we have taken thus far, but as we work to fully transform New Jersey's maternal As we work to fully transform New Jersey's maternal health landscape, we understand that sweeping change requires persistence and unfailing dedication. At the same time, we know the urgency of this crisis remains and that its root cause is, quite simply, institutional racism. Black women in New Jersey are nearly 7 times more likely than white women to die from maternity-related complications, while Latino mothers are 3.5 times more likely to die. Meanwhile, black babies are more than 3 times more likely than white babies to die before their first birthday. This is 2023, and it's unacceptable. As a mother of 4, this terrible knowledge weighs upon my heart every single day, especially because I know that but for the color of my skin, that could have been me, or God forbid, it could have been one of my 4 children. We all know that doulas are a game changer when it comes to maternal and infant health. They support healthy pregnancies by providing culturally appropriate social and emotional support to pregnant women throughout the prenatal period, labor, and delivery, as well as the postpartum period. Study after study shows how doulas help reduce birth complications, lower rates of C-sections, improve mental health, and so very much more. But these results are hardly surprising when you see the powerful bonds that doulas build with the families as they guide them through this exciting but also frightening experience. As I've said many times before, if I could change anything about my 4 pregnancies, it would be to have had a doula support me. So, as part of Nurture NJ, we are doing everything we can to make sure every expectant mother has access to a doula. They are a critical part of our strategy to make New Jersey the safest and most equitable state in the nation to deliver and raise a baby. And we have long recognized that doulas are an essential part of an expecting mother's healthcare team. That is why during the pandemic, we worked to make sure doulas were still able to be with mothers throughout their hospital stay. That is why we've been working to support and expand our community doula workforce by launching a community doula pilot program, multiple across the state, and creating a doula learning collaborative. Since 2018, these programs have trained over 250 doulas that have supported over 650 families across our state. And that is why we became the third state in the nation to expand Medicaid coverage to include doula care. And the first state to require doulas to be culturally competent and community doula trained to be reimbursed by Medicaid. In fact, 4 years ago, it was right here where the governor signed those bills into law. So it is really fitting that we're here today to announce this next important step in our efforts to expand access to doula care for every mother across the state. I am proud to say that with the help of our partners in the legislature, we have Assemblywoman Canano here today, we have introduced legislation that guarantees patients have the legal right to have a doula with them in hospitals and birthing centers before, during, and after labor. The bill will also require these facilities to post their doula policies online and to designate a contact person for doulas. So this legislation will help ensure every mother can have the support of a doula during their greatest moment of need. There is nothing like having a dedicated advocate in the delivery room who is solely focused on you and your baby. Doulas are a voice for a mother's birth plan, and they are experienced navigators helping mothers get through confusing or potentially scary situations. I am thrilled that we are here today to discuss the potential impact this policy will have and how we can work together to protect all of our mothers and their babies across the state. But before we get into the discussion, I must say it does fill me with hope to see us gathered like this. Together, we each represent a key aspect to solving the maternal and infant health crisis. And by breaking down silos and collaborating, there is no doubt that we will. Now, to start off our roundtable, allow me briefly to introduce everyone, and then we can get into the discussion. Of course, feel free to tell us a bit more about yourself as we move forward when we get the chance. So, with us today, we have Senator Renee Burgess.
Hi, good morning, everyone. Thank you.
Assembly Member Annette Chiano. Good morning. As well as Deputy Commissioner of the Department of Health, Robin Ford.
Good morning.
We are also joined by Tonique Griffin, who is a doula here in Newark, who has supported nearly 70 births.
Yes.
And Chanel Bullock.
Good morning.
A mother who was, not surprisingly, supported by Tonique. And I'm really excited because Chanel has brought with her D'Anthony Manowar. Rounding out the group, we have Dr. Damali Campbell Operaji, who has been serving as an OBGYN here at University Hospital for the past 12 years, and who joined me several years ago during the pandemic for one of our Facebook Live Ask the Expert series. So thank you so much for being here. Our first question is for Tonique. As a doula, can you share your perspective in navigating different hospital policies, and how will this bill directly impact and support moms during their pregnancy?
Okay. I'm glad to be here today. I just want to say that first. But I think this bill will help a lot because I've come across different policies at different hospitals, and what is accepted in one place is not accepted in another place. Even a hospital that I'm frequented at, I get different policies from time to time. So some uniformity, some clarity going forward will help a lot with the actual going to the hospital. Like, you don't understand how you wonder how you're going to be accepted at a hospital that you've never been at. And even you also have the challenge of a hospital that you frequent a lot, and who knows who's the nurse going to be is going to accept you to be there after a mom goes through a C-section. I've actually been told that you don't need to be here after a C-section, when that's when I'm a lot more, effective as well to monitor where she can't monitor. So I'm glad to have this bill to create some kind of uniformity across the whole state, because sometimes I'm in South Jersey or in New Brunswick or, Morristown. So everywhere, if everybody have a policy and it can be clearly stated, it'll make my job a lot easier. One less thing to worry about.
There you go. You just explained exactly why we're here today, so thank you so much for that. That was really helpful. And I now want to turn to Chanel. Ooh, maybe not. Chanel, would love to have you maybe explain to us a little bit about how a doula impacted your birthing journey.
Okay. Hello, good morning, everyone. My doula journey started out a little hectic. It started out a little crazy. As you can tell, this is my first child. So I didn't know the ins and outs and the understanding of what it's like to be pregnant. I was actually kind of scared of childbirth, to like actually being in labor. That was like a really big thing I was scared of. Before I had my doula, Miss Tonique, I went through a situation to where I was prescribed by a doctor more medicine than I was supposed to, which caused me later to be hospitalized due to being pregnant. And then afterwards, she kind of helped me understand the ins and outs, understand what I was comfortable with, and understand, like, at least allow me to understand what the process would be like when I go in labor and everything like that. So it was very important to me to have one.
Thank you. Thank you so much. I'm now going to turn to Dr. Operaji. I wonder if you might explain how you have worked with doulas both before, during, and postpartum, and also you've been a tremendous advocate, so I would love to have you speak up and explain why that might be.
Thank you so much. I wanted to say that these issues are deeply personal to me. We talk about statistics a lot, but I was this living statistic, and as some people who know me very well in this very space know that I had a child that was born 16 weeks too soon and unfortunately passed away. So when we talk about 3 times, 4 times, 7 times, those are important numbers, but then we always have to remember that there are people behind these numbers, and we never want to take away that personal aspect of this care that we provide. As a practicing obstetrician, I have seen how labor support can affect a pregnant person, affect their confidence, and affect their ability to feel that they got everything they wanted and needed. It's their birthing experience, and at the end, they're going to remember it for the rest of their life. I think that working alongside doulas is transformative, and I'm so proud to work here at University Hospital. We believe in doulas so much, we actually have a research project where we work with, we're a sub-grant, and we work with Cook County Hospital and Women's Hospital in Louisiana, and we're studying the impact of doulas prenatally. We know the evidence of doulas impact in labor, so our research work is focused on the prenatal aspect of doula care. And in the hospital, I meet regularly with nursing leaders like Lois Green, Dr. Green, who's our Senior Vice President for Wellness, Diversity, Equity, Inclusion, and Population Health. And I also meet with our nursing leaders in our Family Health Division. And so we want to make sure that we're welcoming to doulas and that doulas have access, that our patients at University have access to the evidence-based care that we know improves maternal outcomes. So when I meet with doula groups and they tell me about the difficulties that they have in accessing hospitals, I'm just fortunate that I work at a place where we're already working on this. This is already in progress, and then we can actually help to offer some solutions.
Well, I'm sure I speak for everybody. Talk about paying it forward. As an OBGYN, God bless you and thank you. And thank you for being such a great advocate for the doulas and for our moms. Senator Burgess, I'm going to come to you next, if that's all right. I would love to know if you, as a mother, can speak to the impact of a doula and also how this might reflect upon your community that you represent.
Very much so. Thank you, First Lady. Thank you for even having this conversation. I think it's very important, especially in challenging communities with our, our black and brown mothers experiencing these challenges with having a child without maybe not having the knowledge, right? I can speak for myself. Me having a child was very challenging, and I still get very sensitive about this because both me and my child's life, from me having birth, I received complications because I didn't have the knowledge of what was going on at the time. Did I have some health coverage? Yes. But had I had a doula, now that I know what it is, because I didn't even know what a doula was maybe like 20-something years ago, and I'm not ashamed to say that, right? Because I think I share the sentiments of a lot of people in my area. It was just very sensitive because had I have went through my childbirth, I would have died. So having a doula should always be an option for an expectant mother. Every woman deserves a positive, safe, and secure childbirth experience by having the knowledge and support of what resources are available to make that possible, no matter what your zip code is, right? And I also think it's very important because mental health is a very big issue nowadays. And you have young mothers, you have mothers that don't have anybody to support them. You have people by themselves, right? And without the support of a doula, now that I know what it is and the support that they give, I think that really calls for a successful delivery, not only from the time that they have the baby, but on to the future. So again, I thank you for having this conversation. It's very important, and I think you're doing a great job, as well as everybody on this panel today. Thank you.
Thank you. Like you, I didn't know what a doula was either, and I wish I had known back in the day, but thank you. So, Assemblywoman Quijano, I wonder if you can speak to how this will impact those in your district as well.
Well, first, thank you, First Lady, for the invitation. I appreciate it. So many times women feel unheard and unseen with their issues. Today we're gathered here to build upon New Jersey's commitment to being the safest and most equitable state in the nation for childbirth and early childhood, as championed by you, First Lady, with your Nurture New Jersey initiative. And this aligns closely with my values and objectives that I've worked on in the General Assembly. And I am so proud to be included in this discussion today because I think it's important that it comes to the forefront. And we know that it involves all of us in all of our districts. And as one of the legislators, and I know we share this, I have a diverse district. And so I represent 4 municipalities. And First Lady, you've been to Elizabeth numerous times in my district. So 65% identify as Latino or Hispanic. And right down the street in Roselle, about 50% identify as Black or African American. Those statistics are important because those are the individuals that go about the day, go to the hospital, go get medical care. Now, I didn't know what doulas were, but I knew what comadronas were because in Puerto Rico, we have them. And my great-grandmother was one. But I didn't go into medicine because I can't see blood, so we know that. But I know the stories, and I know my district. And I can tell you the statistics, First Lady, when you're telling statistics, I'm getting emotional here. Because I know of people who have passed away after childbirth, going to a hospital, but didn't get that extra care, someone who knew what they were going through. And so this is so important today, and let's talk about and also yesterday, right, with women that have already had children and know that the experience could have been better had they had that support. So I'm so happy to be here. Well, let's talk about some more statistics because it's important that we talk about them. In Elizabeth, the infant mortality rate for black, non-Hispanic babies was alarmingly high at 10.4 deaths from 2009 to 19, and then Latino or Hispanic women, 4.4%. And I always advocate for women to get their, to go and get checked for everything. And I tell people when mama is sick, the whole family is sick. But when mama dies, the whole family just falls apart. And that's important because these are real people behind these numbers. So many times we just talk about the numbers, but there are real people behind these numbers. I know doulas, or whatever we call them, comadronas, and there's other words from all the different countries, play a key role in overcoming barriers, including language, cultural sensitivity. And these are things that are crucial. And what I say is not all of us have the Brady Bunch family. Let's be honest, we don't, right? So every partner isn't helpful, isn't willing, or involved. Okay? And then there are those that are single mothers. And so we have to make sure that they have the care that they need. We know doulas, with their support, significantly improve health outcomes for mothers and infants, reducing rates of complications, C-sections, and infant mortality. This bill is not just about improving health outcomes, but it's about ensuring equitable access to care for all mothers in our state, regardless of their racial or economic background. And only yesterday, First Lady, I was talking to someone about food distribution, because it's Thanksgiving and we're doing that in our district. And she had to share, because she was such a proud grandmother, she had to share the pictures. And in those pictures was a little granddaughter. And she explained to me that her daughter, for the first time, a Latina, used a doula. So it's so appropriate. So thank you so much for shining a light on this problem, because it does impact all our women. Because either it impacts yourself, as this young lady that's here, or impact someone that you love. So thank you so much.
Thank you. Well, that's a perfect segue to the Deputy Commissioner from the Department of Health. So, Deputy Commissioner Ford, I wonder if you would help share how this bill builds upon all that we have been working with the Department of Health and Nurture NJ on these past number of years.
Absolutely happy to. So first I wanted to say thank you for having us here and for bringing everyone together. And thank you to so many people in the audience that I see that are partners with us on training doulas and working hard to ensure that doulas have access to birthing women in the hospital during their labor. So I want to take a moment and thank you all. And then let's talk about the Department of Health. And thank you for being personal about it. I appreciate that, because a lot of times at the department, we have our regulations, we have legislation, we get caught up in that. And it's so important to bring it back to the person and the work that we're doing every day that improves people's lives. And I try to tell our team that, and it's so nice to hear from you, so thank you for that. This bill is such an important next step in all of our work. As you know, we've been working on training doulas in the community programs since 2018. And you shared the statistic. We've trained over 260 doulas who have assisted in over 600 births, and we're very proud of that fact. And what we'd like to do is this bill allows us now to take that next step in working with our hospital partners and connecting them with different groups in the community that are working with doulas to develop templates to ensure that doulas have access to all women in labor, easy access to all women in labor, so that they can go into the hospital and assist them and do the job that they need to do. It's so thankful that we're here at University Hospital, who has always been such a wonderful partner, and we hope to spread that throughout the state, and this bill is such an important next step in doing that. So thank you again for having us, and we can't wait to start working on it.
Fantastic. Well, I would just like to say the Department of Health and all the work that they have been doing, that you've been doing, you are crucial partners for us, and I thank you so much for leading in, for everyone's leaning in. There are thousands of stakeholders across the state of New Jersey who have helped get us to this point, and I could not be more proud, so thank you. That actually concludes our scheduled program for today. So once again, I want to thank everyone for sharing your perspectives with us, and everything we have heard underscores the importance of our mission and the urgent need to expand access to doulas. By working together, we truly can protect our mothers and babies. And I want everybody to know that the efforts are making a real impact. According to America's Health Rankings, at the beginning of my husband's administration, we were 47th in the nation for maternal mortality rates. And I'm really proud to tell you that as of their last publication, we are now at 27th. So, I know we have a lot more work to do, but we are moving the needle in the right direction. With our collective and persistent commitment, we will root out the institutional racism that has affected every corner of society, all the way, sadly, to our mothers and our babies. So know that all along these words comes action, because when we do this work, we do it for the tens of thousands, even millions of mothers, children, and families we will literally never know. We also do it for our own mothers, our sisters, our aunts, our friends. So we're doing it, and we're doing it for those we love and for those we really just care as human beings about. We do it for those who are no longer with us and those who have yet to be born. That's our commitment, and that's what motivates us every single day, and we will not rest until we make New Jersey the safest and most equitable state in the nation to deliver and raise a baby. So thank you so much.